Hello, my name is Gonzalez. I am a psychiatrist, physician in the Rio Grande Valley. I have a private practice in McAllen, Texas. And I'm here to talk to you today about the mental consequences and complications of diabetes. Now, we like to think about diabetes and how it affects different parts of the body, but many times we forget that diabetes also affects everything above the neck in addition to below the neck. What I mean to say is the brain is also very susceptible to the consequences of high sugars in your blood. If the sugar is too high, you've heard that it can cause damage to the kidneys, to the heart, to the feet, to the eyes, but it's also causing damage to your brain. And we don't talk about that a whole lot, and we don't say much about it. Maybe it's too difficult of a topic, or maybe it's just out of sight, out of mind. But in my practice here for the last 30 years in the Rio Grande Valley as an MD psychiatrist, I have assessed hundreds of diabetic patients who are losing their memory, who are losing their concentration, who are losing their language, and who, if allowed, will suffer from dementia. Dementia that is fully a consequence of the high sugars in the blood in the brain. Now, why would diabetes cause dementia in diabetes patients? Well, because that high sugar that's causing damage in your body is causing damage in your brain with small little strokes, small little damages to the arteries and veins, which then have a consequence of damage in the brain. So the entire brain is affected. Well, what does that mean? Well, we all know that diabetes can cause symptoms of depression, but it can also cause a clinical depression in itself. So just like it causes depression, and diabetes patients are about 3 times more likely to have a depression than those people without diabetes, it can cause a dementia where the patient loses attention, concentration, language, executive abilities, visuospatial problems. So my point to you is today, what I'd like to do is make sure you realize that if you suffer from diabetes, or if your family member suffers from diabetes, that their brain is also being affected. And that damage to the brain has a lot of consequences, just like the rest of the body. So please realize that it is important to maintain your sugars, maintain your healthy lifestyle, maintain your compliance to your medications, so that the consequences, especially the brain consequences of diabetes, don't hurt you as much as they can. Again, this is Gonzalez, Dr. Tomas Gonzalez, and I thank the Rio Grande Valley Diabetes Association for this opportunity to share that with you. Thank you.